Hi, my name's Dr. Ross Hauser. Welcome to Caring Medical Florida. This next case I'm about to present is just fascinating. The patient is a young mother who came from the West Coast with horrible symptoms of burning mouth. The top of the roof of the mouth is burning, the tongue's burning, the back of the throat's burning, and it's been going on for 2 years. The patient has seen just a myriad of physicians, obviously dentists, ENT specialists, and no one has had any success at relieving the terrible burning sensation. The burning inner mouth is there basically 22 hours out of 24. It's horrible. And I think after I present this case, you'll understand why I believe burning mouth syndrome is from cervical instability, specifically upper cervical instability. This case is also going to illustrate why most unusual neurologic conditions are from cervical instability. For instance, if a person had brain fog or they had tachycardia of the heart that would come and go, they have just some unusual symptom that no one can seem to resolve, what I would encourage you to ask yourself is, could this be a cervical instability issue? In this particular patient, when you actually question her further, she has all the signs and symptoms of a cervical instability case. She has horrible dizziness. She has poor balance. She has terrible digestive problems where she has constipation and diarrhea. She has floaters in her eyes. Her vision has some issues. She gets a migraine headache when she's subjected to a lot of light because her pupils can't constrict. She has terrible trouble swallowing. Like when she eats dry food, it gets stuck in her throat. She sounds like somebody who is a 3-pack-a-day smoker. She's very, very hoarse, and she didn't used to be like this. She was an amazing avid athlete. That's when her and her husband fell in love in college. They were both really high-level athletes, and now she's very, very disabled. Her chiropractor was astute and thought that her problem was upper cervical instability, so that's why she came to Caring Medical. But her myriad of symptoms suggest that she has irritation of her vagus nerve, because all of these symptoms can be because the vagus nerve is not functioning properly. It's not giving the right input to the brain, and some of the impulses through the vagus nerve are not getting through. And I think you'll find her digital motion x-ray very fascinating. But before I talk about that, what's also unusual about her case is when I was reviewing her medical history, she had an MRI from a while ago that showed a syrinx from C5 to the mid-thoracic area. So she actually has a fluid-filled sac in her spinal cord, and like I said, it starts at C5, so it'll be interesting in reviewing her digital motion x-ray if she has instability right above where the syrinx is. With our face-down lifestyle, a lot of people are getting cervical ligament laxity, and what that causes is a loss of the cervical curve. That's what we see in this particular patient. We even see that the ligaments in her can't even keep the vertebrae together at all at rest. This is the C1 vertebrae. You can see that it's a little bit tilted. This is C2, C3, C4, C5. And you see right here that if I'm at the posterior edge of C3 and now I'm at the posterior edge of C2, that space there is called an offset. So we know this particular person is going to have severe instability at C2, C3, and there's even offset at C3, C4, and there's offset at C4, C5. So even before there's movement, we know that this particular person is going to have significant ligament injury in these areas. This person also is very loose jointed. And I believe that anybody who has chronic pain and they have extra flexibility throughout their body, that more likely than not, the cause of their chronic pain is going to be ligament injury. So why don't we just do a quick flexion. So we'll see with flexion, and then we'll stop it at the end here. This is C1, C2, C3, C4, C5. See at C4, C5 here. See how much instability there is at C4, C5. So this particular space here, that's the amount of instability. Remember I said that this patient had a syrinx at C5 on down. It goes about 6 levels. Well, most people don't understand that instability of the neck can actually block cerebral spinal fluid flow. So her cerebral spinal fluid flow is getting blocked at C4, C5, and I believe that's the cause of her syrinx. The syrinx, or fluid-filled sac in the spinal cord, is not the cause of her burning mouth. The cause of her burning mouth we will see when we do the open mouth views in her digital motion x-ray. And all we're doing is doing an open mouth view and showing lateral flexion. You'll see the massive amounts of overhang right here of C1 on C2 on the right, and then she'll have it on the left also. She has significant laxity in the capsular ligament, so you can see the amount of overhang here is quite a bit. Like you could see the amount of overhang is quite a bit. I will note that after her third prolotherapy session, her burning mouth symptoms started to go down, because some people come with such severe instability, it may take 2, 3, 4 visits just to get them from the severe stage of instability, which is overhang of more than 3 millimeters, to a moderate amount of instability. But the prognosis for her is excellent to get complete relief, not just of her burning mouth symptoms, but also all the other vagus nerve symptoms that she has, such as a change in her voice quality, the hoarseness, difficulty swallowing, the digestive complaints, the eye complaints, the ear fullness that she has. So she's excited, and we're excited to treat her.